Came back on the air. Sit tight. The plane is about to depart.
All
right, we are back on the air. Ladies and gentlemen, viewers all across the globe, welcome back. Welcome back. Continuing our discussion on diabetes. Now is the moment for signs and symptoms. But Dr. Judith may have one or two things to give to us before we continue on that segment. Dr. Judith, over to you.
Okay. I have here one of our teaching materials. It's called, if you have 2 or more of these risk factors, you have to you really have to do something. And it's the risk factors of diabetes, which is overweight, age 45 years plus. All this we have talked about earlier, but this is just a kind of teaching. You can use it to kind of remind you every day what to look for and what to do. Physically active fewer than 3 times a week. Gestational diabetes, or give birth.
Hold it on the screen for a moment so we can read it. Hold it, don't flip, just hold it on. Did we lose your voice?
You got it? Oh, okay.
Yeah, hold it so the viewers can read it. There you go. Yeah.
Okay.
And where can they find more on that information in case they need to Google it or anything?
This will shortly be on our website.
Okay, great.
Yes. It will shortly be on the foundation website.
Awesome. Viewers, be on the lookout. Go to the foundation website, Global Foundation and Family Health. It will be on the website. You get more details.
And then at the back, we have, what will help you to check your height and your weight, and then score yourself. So
that's going to be able to tell you your BMI, height and weight, be able to tell you BMI and how many calories you need in a day for you to be able to maintain a healthy weight.
Awesome.
So I just wanted to show, I just decided to show this. Thank you.
Excellent. Excellent.
And then don't forget your portion control. It's very important. Everything we talk about here is what?
Portion control. Health as well.
Healthy eating. Eat a little portion every 2 hours. It's better than eating a whole lump of at a time.
So can I ask you a question before? I know Dr. Kate is almost there. When people say I'm not full, what do you get to say about when people say they're eating but they are not full?
If you're eating and you're not full, ask yourself what is going on in that tummy.
Usually, combination of factors will be able to help you. If you want to eat rice, just don't pack rice like Dr. Florence was talking about. You add vegetables and fruits to it.
Oh, yeah.
Drink water first. By the time you finish your vegetables, fruits, and everything put together, and then a little scoop of rice, you will see that you are full. It depends on the combination of what you have in your plate. That's why we always tell not to go for a second round, second portion, because that's when you don't eat to be they don't eat to be full. Sometimes, like I talk in other segments, that you feel hungry, might not be hungry. If you drink water, you find out that maybe actually I'm not even hungry. I just need something. Like sometimes you just need something to bite on. Snack. It's not just food. If you take a handful of almond, eat it as a snack, drink water, you find out that you're not really hungry. Exactly. So it's just like a mental conditioning of, okay, I'm hungry, I gotta have to eat a food of this plate full of rice or food for according to our people. Is then you already conditioned yourself. This is what I'm trying to eat at this point. But by the time you put all these things together, vegetables, full your plate of vegetables. That's what we even encourage our diabetics to do. More of vegetables and fruits. And then if you have to eat carbohydrate, that's healthy carbohydrate, whole grain, then you combination of those will make you full, and you'll be able to be satisfied that you have eaten something, as opposed to being hungry. And then, because probably hunger is not really hunger unless you drink water and find out if you're really hungry or not.
Excellent. Still, while we have you there, signs and symptoms of diabetes. Go ahead.
Okay. Well, we have been talking about this diabetic, and 1 in 5, as we all know, of adults going around with that being diabetic, and they don't even know it. So what are you going to be experiencing? What is that trigger? What are you going to be experiencing in your body that will tell you, okay, maybe I need to be checked out. Maybe I have diabetes. If you are a patient, if you are, but you have increased test, okay, now I don't see myself drinking this water, and I'm drinking a lot of water, and immediately I'm drinking, I'm about to pee it again. He said, what is going on with me? I'm drinking, I'm peeing, and then I am eating a lot. Then eating a lot, you eat, you eat, you drink, you eat, you pee. Okay, that's 3 factors. You are drinking a lot, you are peeing a lot, and you're eating a lot, and then you are thirsty. That's the thirst that make you gonna drink, and then you're gonna pee. This is your body telling you something, that something is going on within you. Okay, that physiology of that is you have high blood sugar within your system. The our body has a limit of any product that we take in the body. It has a limit of its absorption, how much it's going to absorb, and it's going to try to eliminate those ones that it doesn't need. Okay, glucose within the system can only be absorbed 200 grams of it within the nephron. If it goes above that, you know what, I'm going to get rid of this, I don't need that. So as your body try to get rid of the excess glucose you have in the body, sugar goes, water follows it. So you are peeing sugar, water is following it, causing dehydration. You are dehydrated, you thirst. Then your body psychologically, physiology will tell you, drink more water because you're thirsty. Okay? So for you to be able to maintain your plasma volume, right? You're drinking more to keep your whole body system working. Okay? And then you peeing more. So then what body would trigger, because a lot of electrolytes that we have in the body have their different compartments in the body where they stay. Okay. Then potassium, we know, is an intracellular fluid. Okay. But they go hand in hand with each other, sodium and potassium, and potassium and glucose. Okay. Because the body, remember, whenever salt goes, fluid follows it. Then the body will say, okay, now I don't have enough fluids within me. The kidney is saying, what can I do so that I'm not going to pass out? So it triggers, okay, give me potassium, get it from the cells, put it in the system. I'm going to exchange. Trade by barter. I give you this, you give me that. Okay, the potassium goes out, yes. And then it takes sodium in. And then sodium goes, water follows it to be able to balance. You see? So you peeing, you eating, you drinking, and then everything goes haywire. And what usually happens here is, because your body is not, remember we talked about insulin, your body is not using the insulin that you have to push glucose into the cell that needs them. Okay, it stays in the bloodstream. That's when you have this problem. And this goes actually more to both ways, but usually more the type 1 diabetics is more affected by this one, because they're going to have unintentional weight or unexplained weight loss. They are losing weight because that the energy that the body is supposed to extract from the glucose that they have in the body is not being taking place, because the glucose are not inside the cell to be able to get that energy. Okay, and then the body will try to extract energy and glucose from other aspects, from other electrolytes in the body. Then that is another thing that's going to give us the complication of diabetes. And then if you are always I don't know why I'm so tired. I'm fatigued. I can't even get out of bed. That is not me. Then something is going on. What is that that's happening to me? Then fatigue, tiredness, and then okay, I can't see. I'm not that old. I'm just kidding. So you can see having a blurred vision, a child having a blurred vision. Talk to your parents. Tell them, I don't used to feel this way. My vision is kind of blurry. I can't see clearly. Something is really happening to me. So if you extreme thirst, extreme urination, like frequent urination, when you eat a lot, then you're tired, fatigue, weakness, and then all of a sudden you're losing weight. Yeah, we all talk about weight loss, weight loss, weight loss. But you know what? There's a weight loss that's not healthy. This one is you don't want to lose weight, but no matter what you do, you're eating, but you're losing weight. That's another problem with diabetes or signs and symptoms of diabetes. And then all the older people, not older people, anybody that have diabetes, bacteria like sugar. Okay, you have a little cut in your body and it's not slow healing wound on wound that are not healing. Why are they not healing? Is because bacteria are growing within that sore. Okay, infection takes place and the wound is not healing. Okay, I don't know myself to be this way. Before I have a cut, it heals, but right now my cut, my bruises don't heal. What is going on with me? That's a sign and symptom that you have diabetes. Get yourself checked out. And itchy skin, that's people that you see, discoloration. That is so okay. I don't know what happened, but you know what? It just comes in. Anyway, let's forget about that. It's nothing. It's something. If you look at your neck, if you're light skin or even if not even light skin, it's darker it's darker than the rest of your body or under your arm. If you start changing color to the point that, okay, anybody that sees you see, oh, your neck is different from your face or for your other bodies, then that is a sign. It tells a sign that you have diabetes. Get checked out. Then they will be able to tell you whenever with all the process, the different types of way we diagnose diabetes. Your physician will be able to tell you, this is what's going on with you and this is what we're going to do. And that brings me back to if any other of us want to explain. So you have weakness, dysphagia, polydipsia, polyphagia, and then you're weak, you're tired, you fatigue, blood vision, unexplained weight loss, and then itchy skin, dry skin. Though other condition though is not like peculiar to diabetes. There's other conditions that will be able to, like you have hypothyroidism, you can have those things, but that will be able to tell you what's going on with you. Is it another condition or is it diabetes that is on the making in your body? So all these things you have to, like, if you see all these symptoms, talk to your physician, talk to somebody that will be able to help you take a step to either diagnosing you or giving you a step for you to delay you developing food diabetes.
Excellent. Can you throw more light? If I heard you right, you said something about plasma volume. Did I hear you right?
Yes, you do.
Because I'm in the media industry, and when we talk about plasma, we're talking about TV. And when we're talking about volume, we're talking about TV. So plasma volume, like that, plasma volume, okay.
No, it's just blood volume. How much liquid fluids we have within the blood system, not plasma TV.
No, it's the blood.
Fluids in the body.
Okay. Plasma volume. Okay. All right. Sounds good. Sounds good. Well, we're coming almost to the end of the segment. Just a few. I know you made a mention of BMI and PTOS and all that. And can you throw more light on BMI?
Okay. BMI is just because I can't look at you and say we can look at you and say you're overweight. But you know
Exactly.
what? certain things have to come into play to say that you're overweight. That's a general agreement that this is what that is going to be generally acceptable. That when you get to this point, you know you're heading towards being obese, moderate obesity, or morbid obesity. So we all agree that when your height is calculated to your weight, is be able to tell you if you're overweight or not. What the plan, the calendar of what Dr. Judy tells you, Dr. Judy, if you can lift it up a little bit, it usually tells you, if you look at the over, lift it up some, I don't know if uh, viewers are seeing that. It usually tells you from 18.5 is, if you go below 18.5, you're underweight. Okay, there's other people that has some certain disease condition that makes them underweight. Then you are then you if you go between if you stay below 20.5 weight, you're obese. If you go your normal weight, but then if you go above 25.5, then you're trending towards being uh, obesity and then overweight. So that's what, but it's a calculation between your height and your weight division. Then they will be able to give you the ideal weight for you given your height, and then the ideal weight for you if you get over that height and the weight you have, then you're going towards being obese. Then according to that calendar, refer to it, and then that will be able to tell you with your height, you see 5.3, this is where you need to be, and 5.5, this is where you need to be. If you get above that, then that's a problem.
Wow, excellent. BMI. Viewers, you are hearing it live. That's your BMI. Get your BMI numbers so that you know where you belong. It's very important to, like she said, can't look at someone and say, oh yeah, it looks like you're overweight. You don't want to say that. You might get a punch. All right. Well, I've exhausted the talking points, and outside any other thing, let me just ask if there is anything else that we could still talk about on diabetes. I know we have kind of started it up, but yeah, go ahead. Any of the panel members, go ahead.
Yeah, I just want to talk again so that people can know that type 1 diabetes is an autoimmune disease, because the immune system attacks and destroys the cells in the pancreas where insulin is made. It's unclear what caused this attack. They say about 10% of people with diabetes have this type. Autoimmune disease. That's why what I said before, that we have to be sure that our immunity is very, very strong, you know, because of all these diseases. That's the type 1 diabetes is an autoimmune disease. So if people can know that it's an autoimmune disease. And then the type 2, that occurs when the type 2 one occurs when your body becomes resistant to insulin and sugar builds up in your blood. And then the pre-diabetes occurs when your blood sugar is higher than normal, but it's not high enough for a diagnosis of type 2 diabetes. And also the gestational diabetes is high blood sugar during pregnancy, like the doctor said, insulin blocking hormones produced by the placenta cause this type of diabetes. So if you know all these things, and then we watch what you eat, and then by the grace of God, we'll be okay. You know, because some people, they say that, I cannot take the supplement. Yes, supplements is like herbs. It's like food that when you are taking it at times, you don't even hungry and there's no side effects. Something might not taste better in your mouth. Like I know when I was young, so when my mom would give us something to drink, I said that, oh, it's too sweet. I said that, but it's good for your body. It's good for you. It might not be sweet, but it's good for you. So it don't have to depend on something sweet. It's not good for us. So people, they have cancer and they know that sugar is feeding cancer. But they will tell them, eat anything you like. That's not good. And that's why the cancer killed them. Because cancer doesn't kill at all. It's part of the cells in the body. And then if you do what you're supposed to do, and then the cells in your body is healed up, then you'll be fine. So our immunity is very, very important. So that's why I want to say it again. Immunity is very, very important. So that's why when you have a baby, you breastfeed your baby at least 1 year for the baby to have very strong immunity. The baby will not get sick.
Did you say
Baby
1
will be
month?
very healthy. At least 1 year breastfeeding. At least 1 year.
7 days?
At least 1 year for breastfeeding. Not 7 days.
Ladies, are you hearing it?
Yeah, at least 1 year. You can breastfeed your baby for 2 years. I've seen a woman before. I said that when I was in Maryland, she wanted to have 12 children and breastfeed all of them. And so that time, that was 1992 when I had my last born. 1992, so we went to the same clinic together about breastfeeding. She came with 4 of her children. They are still having breast milk. So be able to have good immunity so that they will not be sick. Immunity is very, very important. Wow. Immunity is very, very important. Wow. And you see those children that are breastfeeded, they are very, very smart. They are very, very intelligent and they don't get sick. And as we are going old, then we look for something that will strengthen our immune system so that we don't have all these diseases. You just be listening, hearing about it, but you not come near us.
Excellent. Yeah. Excellent. Well,
what I want to add to what both of them have already said is that yes. Dr. Flores said about breastfeeding for 1 year straight. Is it? I mean, I know that we encourage straight breastfeeding for 6 months, and then because the child will be getting older, and he or she will need a little bit of addition because the breast milk will not fill the child up anymore after 6 months.
Yeah, after 6 months you can see it's solid food and they still breastfeed.
Yeah, yes, if you can breastfeed straight 6 months and then add. I mean, I personally breastfed one of my children. One was 13 months and the other one was 15 months.
For breastfeeding. That's
yes.
good.
So it's always encouraging because when you're giving what you're giving to that child is kind of strengthening the immune system.
Yes.
Helping the child's immune system to be strong. Going back to the symptoms of diabetes, Dr. Kate said it all. And another symptoms I would like to throw in there is the slow healing. When you have sore or frequent infections and all of that, when you have sore, you get slow in healing. So something is wrong. That means your high levels of glucose can lead to poor blood flow. To make that sore to heal rapidly. And then the tingling of hands and feet. When you notice something like that I know sometimes when you get into accidents, you will get that, tingling. But in this case, no accident, nothing, and you notice tingling and loss of sensation in your hands and feet, as well as burning in your arms, or hands, legs, or feet. That means something is wrong. Get tested. Go to your doctor. Go to your primary care. Do something to make sure that you don't have diabetes. You already mentioned about the red, the swollen, and all of that, the tender gums. All these things are symptoms of diabetes. Then the question now is, how do you actually help yourself not to get this diabetes? We've already talked about all of this earlier. You eat right, you exercise. If you happen to be in a family where, there is hereditary or genetics of diabetes, you cannot avoid it, but you can prevent getting it. You can prevent it by doing the right things, eating right, exercising, living good lifestyle. You can't believe it. Smoking as well, you know, has something to do with diabetes. So all these things, if we can prevent certain things, all of this, and eat right. I understand we want to, you know, have our hamburgers and all of that. I don't eat hamburger, but I know people, they want to have their hamburgers, they want to eat pizza every day, they want to do all of that. Think about your lifestyle, think about your family, think about your health, your children. If anything happens to you tomorrow, what's going to happen to those that you're actually feeding all these things to? You know? Again, it's education, education, education. You know, knowledge is power. If you don't know, ask questions. Because it is when you know, you can now teach your family. You can now teach your friends. You can now teach your neighbors, teach people around you on what to do. So don't believe everything that, don't just take in everything that you see out there. Do some research, ask questions. That will guide you on the knowledge of knowing what is right and wrong in your body. Thank you.
Excellent. Excellent. Ask some questions, do some research, living healthy, lowering body weight. I want to say a special thank you to all the panel members this afternoon. We have done really.
Yes, before you conclude, I just want to enlighten more on the last comment that Dr. Judy just said.
Absolutely. Go ahead.
When you talk about numbness and tingling to your hands and feet, it then means the diabetic has gone to having a complication in your body, because it is the damage of the nerves by the high glucose level in the body that's bringing to, and then decreased blood supply that result to you having numbness and tingling to those extremities that we talked about. So slow wound healing, as I said before, and which she emphasized on, is because the slow wound healing. That's why majority of the diabetics, we didn't get to the management more and proper about that. That's why the diabetics are encouraged to examine, assess daily assessment of their feet, because in reference to being numb, I have a patient that coming with a nail in that been there for over a week. He didn't know the nail was in there, walking around on it because it doesn't have any feeling to that leg. Okay, so because it's numb, that's another complication of diabetes. They can't have any feeling to it. I have a patient coming with burns, hot water. They were standing in a bathtub. They don't even know that this is hot, too hot for them. So burns can happen. Things are just complications that will result from being diabetic, uncontrolled blood sugar level in the body. That it can affect different organs in the body, but we didn't get to that. Like she was talking about but your doctor has to go to, because that's why you have to follow up. You do, for you to be able to find if you have gone to developing complications of diabetes. You check, you check your kidney, you check your feet. A patient check their feet every day. When the patient presents, you check their feet and refer them to a podiatrist and be able to take care of that feet if they're having problems. Actually, some of the times we even encourage the diabetes not to do their own nail cutting, because if they cut their nails, it might even result to them having ulcers, which is not going to heal. But the thing is, you already developed diabetes, but if you have a your diabetic control is very tight, all these things will not result. Okay, we didn't get to talking about diagnosis or whatever that we're going to tell you that you have that, because your doctor has to be able to run a blood sample and tell you if you're over this, if you're over 126, you're diabetic. If you want 144 to 125, you're borderline pre-diabetic. And then if you're A1C, which is a lot of things happen. Because she talked about those complications, that's why I want to emphasize on the fact that if you get to the point where you can feel numbness and tingling to your leg and all that, that means you have diabetes and you're not taking care of it, and it's becoming a problem. It's having a complication in you, that your blood sugar has been be continuously high and you're not taking care of it. So I know our time, we're about to run out of time and all that, but maybe we can revisit that. Next time we can be able to talk about diagnosis, on how you diagnose diabetics, and then be able to go in depth of what you can do, the sites, the resources for you that will be able to help you to manage your diabetes. Because we didn't talk about it. How do you really manage this diabetes? The complications of diabetics. If you're type 1 diabetics and you always present with DKA, what do you do? You know, if you're type 2 diabetics, what do you do? How do you handle yourself at home? Okay, that is very, very important to our people. Okay, even people that are here, some people will tell you, I know my body. My patient will come and say, my body, I know when I'm going into low blood sugar or high blood sugar, you know. But then other people don't know, you know. This we need to get out there for them to be able to be honest. If you're having these symptoms, you're going low, or if you're having these symptoms, it is going high. You know, your blood sugar is going low or high. I think they would like us for us to tell them how to diagnose, the process you're going to have to diagnose, and then the real management and what they have to do themselves, or what symptoms they have to look at for them to be able to know and then get help before it gets to the real complication of what diabetes can do to your body. That's my take in this. So I know Dr. Florence has rounded down up on all the topics we talked about the definition and types and every other thing. But I think it's going to be a disservice to viewers if they don't know how diagnosis of diabetes is diagnosed, and then the proper management they have to do, and the complications. If they're seeing this and then they have not been there before, okay, they will be able to say, I need to talk to my doctor. This is happening to me and this has not been there before.
Thank you so much, Dr. Kate. Lots of information, like for always, from you. I want to tell our viewers to appreciate all these are 3 panel members, the 3 medical doctors that we have here. Appreciate their passion for what they are doing. This is a weekend. They should be relaxing or, working with families, but they took almost 2 to 3 hours of their time to even talk here, not to mention the amount of time they spent preparing for the, content that they will deliver. So we thank you so much for all that you're doing. Definitely, yes, when we come back on another segment, we'll talk about the diagnostic and every other thing that follows with it, the effects and stages, if we need to reduce some of the talking points. Other than that, I want to say a special thank you to Dr. Judith, Dr. Kate, and Dr. Florence, Omega Studio, in conjunction with Global Health for Family Foundation. Say thank you, thank you, thank you, thank you, thank you, thank you. If you have not subscribed, viewers, hit the right button there and hit subscribe, so that the moment you go live on air, you get an alert on your device. Thank you so much. And everybody have a great afternoon.
Thank you very much.
Thank you.
Thank you.
We want to also thank our moderator, Casey, for the great work, he has been doing with getting all this information out there and making sure that people are aware of what they should be aware of.
Yes.
So, Mr. Casey, thank you for your hard work in putting all these things together. We appreciate you.
Thank you. Thank you.
Thank you
Thank
all
you very much.
Thank you.